I have a friend who's single, and he works 8 hours a day, 5 days a week. And when he gets home from work, he takes care of his mother, who is frail and elderly, is 92 years of age. All his free time, before and after work, and all the days on the weekend, he takes care of his mother. They're a Latino family, and they're very reluctant to put her in a care facility. So one day I asked him, how's it going? Are you free from dinner? He goes, no, my mom is sick. I was up all night helping her, and I'm running around tired. I said, give your mother a good shot of brandy. And he said, I'm the one who needs that brandy. The beautiful words from Isaiah, we just heard read, are about you. He gives power to the faint, abundant strength to the weak. Though young men faint and grow weary, and youths stagger and fall, they that hope in the Lord will renew their strength. They will soar on eagle's wings. They will run and not grow weary, walk and not grow faint. That's why we're here today, to place our hope in the Lord and thus to renew our strength. You are healthcare professionals. You have many skills. You've studied long and hard. You have earned degrees and passed board certifications. You are experts in science and medicine and care. But as many who have been in this profession for years have told me, healing is still a mystery. Sometimes your diagnosis and your treatment of a patient works and they are healed. Other times you apply all the skill and knowledge available to the human race and the person does not heal. All life is in the hands of God. It's also true that when people cry out to God in pain, when they're sick and suffering and they beseech God for help, He hears their cry and He sends them you. You are the instruments of God's love and mercy to a suffering world. You are Christ's hands and feet in a hurting world. But besides your considerable scientific skill, as Christians, you bring Jesus' love and mercy to your patients by your smile, by your kindness, by your love, but especially by your prayer. I encourage you to pray for your patients. Remember, human beings are not just bodies. We're bodies and souls. We are spiritual beings, and we can benefit from spiritual help. So pray for your patients, and sometimes pray with them. I was chaplain in Portsmouth Navy Hospital in Portsmouth, Virginia. The senior chaplain gave us our assignments. I had to visit every patient every day in the wings of the hospital assigned to me. In the Navy, the chaplains are part of the total care team. So we were allowed to look at the patient's charts so we could see what religion they were, although half the people put no religious reference. But our senior chaplain, very wise, he said, never leave the room after a visit without asking the patient, may I pray for you? No one ever said no. They said, well, I'm not religious, right? I said, it's okay. Do you mind if I say a prayer with you right here? You can say a short prayer. If I knew their religion, I'd make the prayer according to their faith. Every person will say, thank you for that. Your workplace is often characterized by tragedy, anxiety, and fear. In that place, you need to bring peace, calm, grace, and mercy. Where do you get that? We get it from the Lord, who is the source of that. He is grace, love, and mercy in overflowing abundance. Once when I was working as chaplain on the aircraft carrier John C. Stennis, and our aircraft carrier was out in the middle of the Pacific Ocean. On another ship about 100 miles away from us, there was an explosion, and we got the SOS call. We steamed full speed as fast as we could toward that ship that was in peril. When we got close enough, we launched one of our helicopters, went over to the ship where the explosion was, and we took their most seriously wounded sailor. A boiler had blown out in his face. We took him to our operating room because U.S. aircraft carriers have 5,000 sailors aboard. They have every kind of medical device there. So the nurses and doctors were operating on this sailor. And then I heard the announcement over the PA system on the ship. Father Barber, report to the operating room right away. So I ran and got my holy oils. I ran through the ship, up the ladders, into the operating room. As I went in there, the doctors and nurses were bent over to the patient on the operating table. And I asked the surgeon, is he going to make it? And the surgeon said, no, he's dying. He said, Father, do your thing. So I anointed the sailor with holy oil of the sick, said all the prayers and rites. His blood, that sailor's blood, is still on the pages of my book because there was no dry place on his face or head in which to anoint him. He died there. I looked around the table. The nurses and doctors were very young. They were just out of med school or nursing school. They were in their 20s. Some of them were crying. For many of them, it was their first experience of death. An hour or so later, the ship's head surgeon invited me to join the debriefing for the medical team that had performed the work on that sailor. He asked the medical team, as you do when you do a PTSD debriefing, 3 questions. What happened? How do you feel about it? And what can you now do about it? So they went around and they each shared. They can't bring him back to life. Some of them felt responsible for his death. But one of the doctors, a young nurse, she said to me, she's a young doctor, she said, I'm not Catholic, but I so loved the beautiful prayers you said for those Catholic rites. You are doctors and nurses and healthcare professionals, but we're not gods. Only God is the author of life and death. The first lines of the chapter of Isaiah, chapter 40, which we heard today, say this: comfort, give comfort to my people, says your God. You do that every day. You give comfort to your patients. Just make sure you give comfort to each other, and support, and prayer, and sometimes a shot of brandy.